First of all, thanks for having me again. It's always a pleasure to see our students and their work in action. And so one of the biggest changes we've had so far is bringing back our in-person students to 4 days a week of instruction. And that was made pretty recently, sometime in January. Again, it's hard to recall now because we did have a week of remote before that actually was able to happen. And, that was a big change and something we really felt very strongly about. A lot of our students were discussing their struggles with the hybrid model and managing their own time. And so we really wanted to make sure that the value of in-person instruction was brought back. So the Board of Education fulfilled that change. And so far, everything has been going very smoothly. I think children are very happy, those that are in person, to be back, even 4 days a week with their peers. It brings a sense of normalcy when we really haven't had that in almost a year now, which is amazing to even think that it's already been 11 months of this. And then even more recently, the governor had approved very suddenly, actually, no one was really expecting it, the return of high risk sports. I know our athletes are very happy to get back out there. Again, some sense of normalcy with increased protocols, but definitely important for all of our well-being. So yes, January was significant, but all of the researchers, the scientists knew that was going to happen. They said between the travel and the holiday season, that is where the exposure was going to happen. And that's where we were going to see the numbers increase. And that is exactly what happened, according to the scientists. In February, we've seen it gone the other way. The numbers are going down significantly. I also think that the holidays have passed. So, the travel has lessened. And I think a lot of people, even if they weren't traveling by air, were driving places or seeing family members that they hadn't seen in quite some time. So we definitely saw that. But we're also on the upside of the vaccine, right? So we are seeing more people vaccinated every day, including our school employees, which are all eligible under 1B. And some of the vulnerable populations of 65 and over are also eligible. So that's really always has been, and you know this, our biggest concern is the vulnerable population because they are more prone to hospitalization, they are more prone to death. So now that they're eligible to get vaccinated, we know that that's going to change and those numbers are going to go down. So it's a tough part, but I do think that we're on the light at the end of the tunnel. We're really starting to go into a new place where we're going to see those numbers continue to decrease. I think that there's always going to be a what if, and that was the concern that so many people had. Well, what if this, and what if, the vaccine is delayed, or what if the new variant? And what we're noticing, and I'm sure you've seen it in the local media as well as the national media, about students' mental health. It is really an increasing problem. The isolation you saw out west with teen suicide increasing, and we have thankfully had not had that kind of increase, but we have seen an increase in hospitalizations for students, whether it needing some support and mental health supports we're talking about. So, to hear those things. And we also had a great number of students who were not doing as well as they usually do. When you look at grades and things like that, even though they have Mondays to kind of get themselves together and work on missing assignments and follow up with teachers, it still seems that many of our students are struggling well more than usual. And all of that information was really pressing us to get students back to in-person when they really need their teacher. That accountability is so important. When you see a teacher versus, well, I'm not going to see them for a few days and, or not answering an email, we really thought it was important. So the health and safety, it's trying to be weighed with the mental health and safety of our students. And to be quite honest with you, we quarantined a lot of kids early on. It was like the second they were exposed to a case, they were quarantined. We were very strict with our quarantining to start. And we stayed that way for a few months. And we did not see a single case of transmission. So in our schools, and so when we were talking about those environments, we were actually doing more harm than good, right? We're isolating children from their families. We're isolating them from their social events. Even our staff members, some of them, when they were getting quarantined, were not able to go to the vaccine appointments because they're subject to quarantine. And that's a big concern as well. So we didn't have the data to support all that quarantining, and it was not happening, the transmission in schools. We couldn't trace it that way. There's so many factors associated with transmission. So we said, you know what, I think that it's time that we open 4 days. And like I said, even though it feels like there's never a good time because there's so many unknowns in a pandemic, we waited long enough for our kids, and we really needed to bring them back to 4 days. So some of the numbers that we're looking at, you may remember back in December, the governor was really setting those numbers. He had these micro cluster zones, and he was setting the numbers about if we were red or orange or yellow and whether or not we would stay open. Some of the other numbers we look at, and that's what happened in January when we went remote for a week, is our staffing numbers. So we had a certain number of staff members that were quarantined or exposed or sick themselves. And so we didn't even have enough people to run all our classes. So that was a number we monitor internally. But we look at all the rates. We look at the Port Jefferson rates. We look at the hospitalization rates, and those are all basically county numbers. And we have to weigh it all. So there isn't necessarily one number we're looking at, which is why it's so complex. And so we're guided by those state, the government, and then of course our own internal numbers. We did not have a significant number of cases. We had more cases coming back from the holidays, and a lot of that had to do with the socialization of students. Because when we contact traced, we said, well, what happened? And I was exposed because I was with so-and-so who was already tested positive. So we knew where those things were happening together. Or perhaps they were already quarantined because a family member had COVID. So we knew most of the situations of how the children or the staff members contracted the virus. So that's the kind of deep data analysis we do, not just straight numbers. Where is this coming from? Is it coming from inside our schools, which would be a very different conversation, which we have not seen yet, versus we know where they contracted it outside of our schools. When we're looking at contact tracing, and like I said, you're saying, okay, the biggest indicators that we use, it has to be within 6 feet and for more than 10 minutes. And that is with or without a mask, with or without a desk partition. That's the Suffolk County Department of Health Services definition of a close contact, of somebody who's COVID positive and know you've been exposed. So over the course of the opening since September, we quarantined anybody who was a close contact, right? We had this very broad brush, and we said, if you were even in class with this person, even if you sat across the chorus room from them, you're still considered a close contact. We wanted to really be strict with that. And when we looked at students on that quarantine list, none of them contracted the virus. They might have been exposed, but they never actually got sick and contracted the virus. So that's the numbers that we're looking at in terms of transmissions in our schools. There was, and again, that's for classrooms. There is some speculation about the bus, and we can't really tell completely about that. I'm going to be very frank with you. But most of the time, from what we can see, the schools. And I do think it has to do with the masks. I'll share a very personal story. My daughter was exposed from her tutor, and they sat across a kitchen table and had an in-person tutoring experience. My daughter was masked. The tutor was masked. And literally within a day, the tutor tested positive. So I was very concerned as a parent, wondering about my own daughter's health. And I waited the 5 days as the pediatrician suggested and brought her in to get tested. And the pediatrician, with absolute certainty, said to me, "It's highly unlikely." And I said, "Well, what do you mean it's highly unlikely? She was across a kitchen table. It was within 6 feet. It was more than 10 minutes. Clearly they were a close contact. There was no doubt in my mind." And she said, "Well, they were both masked. And the probability even when in a close proximity, both masked, is much less." And that was such an aha moment for me. Even though it's one pediatrician and one doctor, she was so affirmative about the masks and how effective masks are with transmission, that it really helped me realize why schools have been so effective, because we mandate the masks, because we are so emphatic about keeping your mask on, keeping it over your nose, and reminding students of that and reminding teachers of that. So I really think that that's the big one of the protocols that has really helped with transmission. And again, it's not, you can't disprove it, to your point, Peggy, right? I can't prove otherwise. But we're not the only school experiencing that. You know, when you hear the governor talk about schools being safe places across the country, when they put these protocols, especially masks, in place, they've been able to stay open without evidence of transmission in schools. So we can't be alone in that, right? There's so many schools to show that same pattern of data sets. So that's what I think would be it. We can't mandate vaccinations, but yes, we are strongly encouraging our teachers to get vaccinated. And as you see, even in the media, there's such a difference in opinion on vaccines, right? You have the camp that is worried about the effects. So we can't mandate because we really don't know somebody's underlying health conditions and what their circumstances might be that they are not able to get a vaccination, or it's not recommended by their own physician. But we are strongly encouraging them if they're able to. The biggest challenge is getting an appointment, as you mentioned. Unfortunately, the governor kind of just opened the gates and allowed all of 1B at the same time with a very poor electronic system for getting those appointments. I know many of our staff members have been diligently refreshing their pages to get appointments. And I've heard a lot of great stories about people getting right into Stony Brook. Some people got into St. Charles. There was a few appointments there very quickly that went very quickly. And then now there's a whole new list of appointments that has come out of Stony Brook. So we've seen that. The district has tried to partner. You know, we really wanted to try to make it easy. And we tried to reach out to St. Charles and to Mather to see if we could do a partnership. You might have seen that in certain school districts that have been able to do that, only a few, but some have been successful in getting partnerships. We have not been successful. We tried, to do that. I think that the supply of the vaccine is what's prohibiting some of the local health departments, health places such as Mather or St. Charles from doing that. It's not that they don't want to help us and get our people vaccinated. They just don't have the supply to do so. So it's getting better. I will say that, from somebody who's been trying to get, her mom and things like that on there, it's getting better. And I do hear more people getting appointments. And we're trying to establish a way to collect that information from staff members that when they've been fully vaccinated, how to let us know. As of right now, from what I've been monitoring, at least I think we're going to continue to be protected even with the new variant. So fingers crossed it stays that way and that nothing changes. But I think we'd have to be in the same position to examine those facts when we got to it. A lot of people did not want to be submitted to testing. That was the other part. We put out that willingness to test survey. And we did not get a tremendous response with people that were willing to be tested voluntarily. So there's a cost associated, there's training involved. There's a lot of medical waste that has to be taken away with testing. There's a whole system that you have to actually sign up for to enter all of the data every single day that you test. So the cost and the associated temperature from the community about testing was not there, I would say, to move forward with that effort. But as far as athletics, that was a mandate. So we didn't really have much of a choice to do that. But I think that we are also moving towards more of our staff getting the vaccination. That's where we want to see people getting their efforts so that we have that to say, hey, this number of staff members are vaccinated. So we feel very comfortable coming to work and things like that. So there's a cost associated also with testing and mandatory. And it's controversial about whether or not some of these rapid tests, even the ones that we're doing for athletics, the reliability, right? So we were using the Binex Now test that's provided by the state because it's being mandated by the county. And there is some variability of the reliability of that exam. And I know you all have done a lot of reporting on this, but we also know that the PCR test is more reliable than the rapid test, right? Because there has to be a large number of the virus in your body at the time of the rapid test. So that rapid test is only as good as that moment that you take it. And perhaps, a few days later, you could develop symptoms and you could have more of the virus in your body. So it's a tough part, right? The idea of testing was to say we'd identify the asymptomatic spreaders. But I don't think even with a rapid test that you're identifying the asymptomatic carriers. You're really identifying those that are symptomatic at that point. It's the same state provided Binex now. It's a rapid 15-minute test, so that the results will be available to students right then and there. They don't have to wait. And so we will have all the coaches have to be, even if you're a volunteer coach, even if you're a teaching assistant who perhaps works with a student on a team, you have to be tested. So we're having our first bunch today. So we'll see, we'll see how it goes. We do have a small number of them that we're able to use for the community. We have not opened that yet, but the Department of Health has said that we can use them in that. We really wanted to focus on athletes first and see how it goes before we start opening it up to students. But it is a possibility for the future. We work very closely with the Suffolk County Department of Services. That's our local health department. They actually have all their guidance from the New York State Department of Health. And what's really confusing for many people is the CDC is our national health organization, and they set out guidelines, but each state has to adopt their own. So sometimes there's a lot of confusion about that because people say, well, the CDC says, and we say, we know the CDC says this, but New York State Department of Health only adopted this part of the guidelines. And that was a lot of confusion with travel and early release from quarantine that people had. So primarily, we really focus on our Suffolk County Department of Health Services and then also our state Department of Health. And so when we ever have a question in terms of contact tracing or testing, those are the people that we're working with. The other organization we work a lot with is obviously the Suffolk County Superintendents Association. The leadership of the Suffolk County Superintendents, so all the superintendents in Suffolk County are part of this organization, and the leadership of that organization actually has a very strong relationship with the county officials, Steve Ballone, the county executive, and then of course the deputy commissioner of that health department. So they filter information to all the superintendents as well, which is really helpful because it's a partnership in terms of working together on that. And really the administrative team, and Mr. Sherrard, our COVID coordinator, we like to call him, those are the people that are working and reaching out to the appropriate officials when necessary in terms of contact tracing. So a few organizations, but a lot of it unfortunately falls on the district to do a lot of that. And when you have questions or you have concerns, then you can reach out for consultation. But on a general everyday basis, kind of on your own in some of them at this point, which is tough. Some of the English rooms are very small compared to, let's say, the social studies rooms. So that's all taken into account as well, because even one row between certain classrooms might be 6 feet. In other classrooms, it might not be 6 feet. So the seating chart is important, but also the proportionate sizes of the rooms is what also is very important in that contact tracing. So when we do have a positive case and we know that somebody has been in our schools during a contagious period, the administrative team starts to interview the classroom teachers of that, wherever that child or staff member was, and ask them about their seating charts and ask them if there was group work. And if there's ever a doubt, if there's ever where it's hard to recollect, well, did I do group work that day? We will still err on the side of caution. But if they can say, it was primarily lecture, everybody sat where they were supposed to, we can kind of say to certain students, okay, this area that's within that 6 feet, these 4 or 5 students might be subject to quarantine, whereas the rest of the class may not be. So all of that data collection and interviewing is really what's important in terms of getting the contact list established. So, a lot of the facilities changes has to do with cleaning routines and the way things are sanitized, which kids may not see during the day. That usually happens at night. We do sanitize the desks and the desk shields every night with a sprayer, and it stays on for a minute, and then it's considered sanitized every night. And, that's really the main changes, I would say. Obviously, the things that happen with lockers and the staggered arrival and things like that. So those are all kind of the same, but I think really the precautions in the classroom are what we really needed to improve upon. As you mentioned, keeping the masks on, making sure we were doing as many of those procedures as we could. It's a teacher's authority to open those windows. We, again, strongly encourage them to keep those windows open and keep the airflow circulating. But as you mentioned, when it's 9 degrees, the feels like temperature is 9 degrees. Sometimes that doesn't help because then the heat kicks on even more, right? A lot of our heaters are right by the windows, which is not really efficient, but that's what happens. So I think it's a balance of trying to keep the comfort level of the students at the same time of that circulation. But again, if there are specific things, our principals are so open and willing to listen. And I really think that if students advocate and want to say, hey, this is a classroom I'm concerned about, the size, the windows aren't open, then they should really bring those forward, because it's impossible for us to monitor all of that all the time. So we really would appreciate if they share those things with us. Our students have learned a great deal. You talk about the words of grit and adversity, and working through things. And the most difficult part is that some students can't get through that. They can't persevere. So we're trying to help them the best we can and give them the supports to do that. But not all children are naturally, they can't naturally persevere. They struggle a little bit more with it. They're more sensitive about certain things, or they take things very deeply, depending on their own personal personalities or circumstances with their families. It depends on what they've been through. So we try to take that all into consideration when making decisions. And it's a very tough thing. We don't take these things lightly. We are always trying to balance the health and safety with the mental health and safety, not only of our students, but of our staff members. It's really of our staff members coming to work every day in their own family conditions and their own health conditions. It's a tremendous balance. So we do the best we can, and that's what leadership is about. I know the staff has gone through some professional development regarding the conversations we just had. And then also our psychologists, social worker, and guidance counselors have been in every classroom talking to kids, showing their support, and how to reach out if they need it. And they were very informal conversations. I know that they actually briefed the board recently on those presentations that they did. I know Ms. Britt and Ms. Wendell did them in the high school, middle school, and our new psychologist, Ms. Hoffler, did it in the middle school as well with Ms. Britt, and then Dr. Carlson down in the elementary school as well. So they really wanted to go in, not a structured program, because they felt that with such a structure, they might turn students away if they felt like it was overwhelming or daunting, but more of a conversation. Hey, how are you? Here's who we are. If you don't know us, and maybe there's a stigma attached with going to the psychologist or social worker, but we're here to help. And they had some very good conversations. They also started that Port Jeff Pulse, where there was some questions that went out to staff and to students to get a sense of how they're doing and what supports that would be needed, whether it's individual supports or more supports that would be across the district. So we're working through that. And I think that the most important is your teachers. Your classroom teachers are the ones that are going to see the most of you and notice any patterns or discussions. And the same methodology that we've used a lot about that trusted adult would be something that we would continue to perpetuate, that if you have somebody you can talk to, you'll always reach out to that person. So we've continued to make sure that our teachers are the first line of defense in either letting us know, hey, something's not right with so-and-so, I'm looking at their grades or maybe their disposition in the classroom. I've reached out, but they might need some additional support. So that's really our frontline workers, I call them. They're the ones that see the concerns with our students first. So we've done a lot of work with them and noticing those signs. Well, our remote population is not as large as our in-school population. We don't have the same numbers as some of the larger districts do with remote. I mean, there are larger districts that have teachers that are primarily focused on just remote students. They are only assigned to remote students. In Port Jefferson, we don't have those same numbers. We also have the flexibility in Port Jefferson for kids to come in and out. So what we're seeing is that you maintain your same schedule. If you were in a different district with a remote student, you might not be able to get the same electives that you were able to get in Port Jefferson. And we wanted to say, if circumstances in the world change or health changes for you and your family, and maybe you're vaccinated or, things happen differently, that you have the ability to come back and still be connected with the same teachers, not have to change classrooms, not have to change, your schedule. You're basically able to move between the in-person environment and the remote environment. And this has been incredibly helpful, mostly for students who have either been quarantined because of circumstances outside of school or because of been quarantined or sick themselves. And so we needed that flexibility. which is why we didn't establish a remote academy. And we also didn't have the numbers. So right now, our numbers are not that high of students that are primarily remote. And we've also seen a tremendous amount of temporary remote students, right? So for 2 or 3 weeks at a time because of quarantine or individual family situations. So one, it's just a matter of numbers, right? Where do you put your resources where most of your, your children are? But also, we do have a day, Monday, asynchronous, is really for our teachers to prepare for our remote students. So they do have time to work on office hours and connecting and things like that to connect with our remote students. So really, it's a balance of the same teachers that are trying to address the needs of the in-person students as well as the remote students, which is different from other districts. So, we really have a lot of students that are in school right now as well that need just as much support. I think the first thing is that they have to talk to their teachers, right? They have to be their own advocates first. And so what we're finding is that loss of connection when the teacher can't say to them, hey, what's going on? Or you're missing an assignment, where is it? There's also a lag time, right? You're emailing, now you're waiting for a response, and maybe where if you were in class at that point, I think for our remote students, the hardest part for them is they have to be their own advocates. They have to learn to say, hey, I need an extension, or I'm having trouble on such and such assignment because of whatever the circumstances are home. So I would really encourage them to continue to reach out to their teachers and communicate when they are struggling, because it isn't the same connection and we wouldn't necessarily always know. And use some of those, you don't have to go in the Google Classroom and do those assignments from the psychologists, but send an email, make a phone call and say, hey, I just need some talk, have a conversation, about it. I think that's the biggest thing I would share with them, to really advocate for themselves. And it's a great lesson moving into the college or career world. Most of that has to do with your building principle. And establishing those kinds of conversations. It's not just an automatic. You can't just say, hey, I'm taking a virtual day, because we want some accountability for the students, to make sure that they're not just telling their parents they're going to school and then they're not. So of course, we would like the child and their parents to have that conversation with the principal and say, here's our circumstances. This is why we're going to go remote for a few weeks, or why we're going to stay hybrid. And they can discuss those very specific circumstances with their building principal so that they can decide if it's approved, really would be the best way to do it. It is always helpful to have that dialogue. So that would be the process before moving forward. We are servants, we're servants to the community, to the students, and we balance it all. So we've heard from, and you also have to balance your input from your staff as well, right? Because they're the ones that make the engine run. They're the people out there doing it every day. It's difficult. And there's also financial decisions that weigh into it. So it's a very complex decision. And the most important thing that we're always guided by is what is best for students. That question comes up a million times, where we keep saying to people when they say, well, we can't do it because of this. What's best for kids? Then we have to make it work, that kind of thing. So we do listen to the students, we do listen to the families, and we do listen to the staff. But it always comes back to our North Star, which is all of you, the students, because that's what we're here for. I think with not being in school at all last year, that was a real detriment to a lot of us. And so I'm just so proud of everybody that we've made it this far, and that we're going to get through it. I really look forward to opening a regular opening in September. That's my golden light right now, is that we're going to be through the vaccines and we're going to have a regular opening in September. So I am just so grateful to this community and the students and everybody who has worked so hard to get us this far. Because without all of you and implementing the changes and pushing through, we wouldn't be here. So I can't say thank you enough to everybody.